You're listening to the Gabe Molina Podcast.
You know what?
Thank goodness.
We're going to find something weird about you. And we're going to spend 2 hours on
Oh
it.
my God. I'm
Hey,
watching it.
What's weird?
I have a lot of,
Text me what it is.
he's going to be looking at his phone. Don't text.
I won't see it till y'all leave because it's up there.
Yeah, exactly. That's true. So you won't know.
Is you ready?
I'm ready. Let's do it.
Are you super ready?
I'm pumped.
Okay.
I'm born for this.
Let me clap so that I sync all the audios. All right.
Did it sync?
We'll find out when I start editing. I told you it's a one-man show, and I have no clue what I'm doing.
Well, you learn as you grow. You grow as you learn. You learn as you grow.
I don't need to be growing.
Okay, well, you have to if you want to learn.
Going.
Or going. Whichever.
Danielle
Yes.
Aguilar?
Yes.
I have some friends who are Aguilar, so that's how I remembered.
Oh, no wonder. Okay.
And so you were with Reaction Sports.
You're close.
Rehab.
Rehab, and Sports Performance.
And Sports Performance.
You were very close.
So are you the owner, or what are you
Yes, I am the owner. I am also full-time, obviously, owner and full-time sports performance physical therapist. We're a three-man show right now. The next employee that we hired, friend first, nurse second, social media manager third. Yeah. She goes by Natalie Serna.
So you're hired right now?
Mm-hmm.
Very cool.
100%. She's been, so it was me for the first, I hadn't even been a full year with Reaction. We had met when I was employed at another clinic. It was awesome. Texas Physical Therapy Specialist. Shout out to them. And that's where I met her by happenstance, and then evolved into a Reaction athlete. And then eventually, we became really good friends. She flippantly said, I love taking pictures. I said, what do you think about taking pictures with Reaction?
Yeah. That's
how she came on board. And then eventually added on my buddy, AKA Dr. Kelsey Eid, which she is transitioning to full-time very soon, if not by the end of this month.
So you guys have been that busy?
Yeah. It's been a true blessing. We've made some really cool partnerships from gymnastics gyms to dance studios to fire departments to jiu-jitsu gyms to CrossFit gyms. It's been such a ride, and it's so fun. Gosh, it's so fun. I get to do this, right? Like I can square off time to come hang out. I can't give you a reason why I would go back.
Is it a pretty tight market? Or are you finding that there's a real need for something like this?
You could say yes and no in terms of yes, there's a tight market, but the need is there at the same time. Because in the field that I'm in, when I was in a traditional run-of-the-mill PT, and it sounds derogative in my mind, but I was in that setting for a better part of my career. And in talking with those athletes, it was very much, well, man, like now that insurance doesn't pay for the performance side, that's it. And I couldn't provide the care that they needed, or the treatment they needed, or the programming that they needed once they hit the goals that were necessary, that were necessary or deemed appropriate by insurance. Once the insurance said,
which is never enough.
No, gosh, it never is.
Yeah.
And I can't tell you how many headaches I had trying to figure out ways to word it to where, hey, they still need more, but the insurance is like, wait a minute, you said they could already run. Why do they need more?
Yeah.
And I'm thinking it's because they're not just trying to run, and they need to be able to plant and push, and they want to be able to jump higher, run faster, push more weight. And that's not our problem. They need to figure that's considered personal training. I was a personal trainer on the better part of 6 years. I didn't have the knowledge I have now. I was just smart enough to make sure you don't hurt yourself, And I had just enough knowledge to make sure that I could program relatively appropriate for the age.
Yeah.
And so the need was there in that setting. And then it just grew and grew and grew. And then finally, push come to shove, I took that leap of faith and went full time. And it was the best decision I made. It's still very scary. You know what I'm saying? And I stand very firm in that. I stand so firm in that because I wouldn't be here. Black and white, I would not be here. I wouldn't be standing here with an amazing team about to go for our second, our second year with this humongous competition that we're growing into. It's just such a cool feeling to have a team that believes in it, people that believe in us, and, those kinds of things. It's just, all those things are just crazy. It's just crazy that I'm here now and I want so much more,
So what you're doing is basically post physical therapy, right? So like you said, the insurance will say, hey, we're going to get them up to here. And typically people go that route because they need the insurance to cover whatever they need to cover. And they're typically coming off of like an injury or maybe a surgery or something. Once they get, basically the insurance is getting them to the starting line again.
Exactly.
And a lot of, it sounds like what you provide is more preemptive, right? We're strengthening, we're getting better, we're getting stronger, we're tightening muscles and ligaments and tendons to prevent this from happening again.
Yeah, we like to lead with that.
So, I mean, you know what's weird is something like that. Here I am, a fat guy giving health advice, but it's like that kind of thing. You would think that insurance, now, we can go down an insurance rabbit hole, but I won't do it because
let's not do it.
We agreed not to do 4 hours.
I know, right?
But it's kind of like that's that amongst other health issues, and I'm just guilty. I'm a fat guy. We just had that conversation. But it's like to be able to maybe on an insurance side say, hey, we're going to cover a little more to help avoid future injuries that cost the insurance company a lot of money. It's this weird.
Yeah, they want you to do these like annual checkups or monthly checkups. Go see your doctor, your primary care. Go do that. We'll pay for that. Outside of that, it's, hey, just take that. That's as far as we're going to go. So they are touching that realm. What we want to do is, we have maintenance programs for that exact reason. As long as you're moving, period, your body needs maintenance. That's just what it is. Your body thrives on movement, but then it's pissed when you move too much because then you're sore.
I'm just going to tell you right now that even if you don't move, it still needs maintenance.
Yeah, right.
We're fixing to get into my shit here in a minute.
Fair. Either way you look at it, you're speaking to my point. Yeah. And so, we do pride ourselves on injury prevention, 100%. We do very much work with athletes. Probably 85% of our population is very much active and trying to elevate their performance and reduce the likelihood of injury. But in that same breath, we do see patients from the beginning where they have had the surgery. And in these traditional run-of-the-mill clinics that I was a part of, it's a 1 to 4. And I don't get the privilege of working with these patients.
What do you mean by 1 to 4?
It's me with 4 other patients at a time.
You. So it's right. So you can't give them really one-on-one attention.
I can't. And it's just not conducive to a lucrative business in terms of when you're running an insurance-based clinic. You just can't do it. Yeah. You need to see at minimum 2 at a time in order to see that reimbursement.
Isn't that wild? It's
a business, right?
Right. And so that's how it works. There's so many weird things. Keep going, because I'm going to end up in the insurance area.
Yeah,
just
it's hard not to. You know, I grew really, really, exhausted is the word I think of, because we were averaging, our requirement as insurance-based clinicians is roughly 14 to 16 patients a day. Wow. That's a lot. Yeah. And then, there's going to be sometimes where we don't hit that, so we have to make up for it. We can see up to 21 patients a day. That, I don't care who you are, it's just not sustainable. I thought I was doing right by trying to get everyone in, and I was young, dumb, and at the time a spring chicken. Yeah, I'll see 21 patients. I got this. Give me a
we're super cocky young. I'll do it all.
I could do what do you need me to do? Yeah, I could do that. Boy, was I wrong, and I really found myself getting burnt out quickly. I still had a really good group that I worked with and still valued, what I had to offer. But in the end, it did not matter. If you're not meeting the criteria, they're not making money, and everything's a business, and I respect that. But, the insurance is a business, and they need to make sure they're getting their cut. And it just made it hard to be happy with what I was doing because my quality of care diminished. Tons. It was to the point where I was like, hey, do you remember what you did last time? Let's do that, but let's try and capitalize off of that. And I'm embarrassed to say it, but it's true. I could not provide the care that I'm providing now. I just couldn't. But now on the flip side, it's an investment. If I'm going to keep my doors open and be able to provide optimal care, because I know I can, it's not being cocky, it's not being arrogant, it's being confident. It's if you in your preparedness is when you're going to deliver your best product. I am prepared enough because I did the work. Now you being an athlete, you being a post-operative patient, you're going to know that I have the tools to give you what you need, with the idea that it is going to be investment in yourself.
Yeah.
And where we run into that wall from an insurance based is very, very hard, because you have parents, hey, I'm already paying X amount of dollars for insurance. All I have to do is pay a $25 copay and see a PT. I don't even fight that. I'm like, hey, I was there. Go take advantage of that. I'll be here when you're ready.
Yeah.
And a lot of the times, not thankfully, because I was in that setting and I strived to provide as much as I could. But then there are just sometimes I couldn't. Like, hey, I can't get to you today. It's going to be next week, because everyone has that same mindset. I'm paying $200, $300, $400 a month. I'm going to get my money's worth, Yeah. And so they're trying to squeeze in as many PT sessions as they can. And so that's where I'm seeing 18, 19, 20, 21 patients. I'm giving you the bare minimum. So it's truthfully, I encourage people to use their insurance because they're paying.
And that's in the insurance setting.
That's in the insurance space, yeah. And a lot of people don't know that, right? And I want to be respectful and mindful that you are putting in that much money a month. You might as well use it. And a lot of the times you can get away with foundational exercises that, any PT can do when you have a technician that can tell you, hey, do a leg raise. I'll be back to come check on you. Right? Like anyone, your insurance is paying for that, black and white. And I was a part of that. If you want something very much tailored to you, I'm your person, right? It's just, I'm not so much me, but reaction. Reaction is the entity you want to be around, knowing that you have access to me. When I was in that other setting, it was very much, hey, I'll get back to you whenever I can.
Did you find it frustrating for yourself because you strike me as the type of person that is passionate about what you do. You take pride in what you do, and you want to provide the best service possible. And it sounds like in the traditional insurance-based atmosphere, that's really hindered. And I'll be honest with you, there's times where I'm at my job and I feel like, what the fuck am I doing? Why am I doing this?
Right.
And it's almost like you talked about taking that leap of faith and jumping into this new thing. Did you find that not only was it maybe a dream that you had to maybe own your own business or work for yourself, but did you find yourself being more fulfilled and in turn being more enthusiastic with the time that you have with your clients, right? Because when there's a happy Danielle and she's excited and pumped up, granted you may have 30 minutes, an hour, or whatever the length of time it is in that day, when you're there and you're ready to go and you're pumped up about it and you're excited, people are going to get more bang for their buck than as opposed to you going, hey, we did 12 leg lifts last week, or, now do 14 and I'm going to go fill out paperwork. You know what I'm saying?
Nailed it. Yeah. I mean, that is literally summing up what my workday looked like. There's a lot that I got, fulfillment from. Right. I helped with the sports residency program. There was a lot of things that I helped develop from a managerial standpoint. So I learned so much from where I was at, and it's not any fault of theirs. That's just the framework that is built around insurance. And I get it. And I'm grateful for being exposed to it, because now in the position I'm in, I'm way more appreciative in being in this position to be able to provide that care. And you're right. I'm super passionate about it. Because you want someone that loves what they do, right? If you have someone that's just kind of going through the motions, what are you doing? I'm super, super, super blessed. And I say that over and over again, to be in this position. It wasn't handed to me by any means. And to know that I get this opportunity to work with these people day in and day out is fantastic. Yeah. I dictate my schedule to an extent. I definitely want to be adaptable to the athlete as much as possible. and then make sure that they're getting everything that they need from, the programming that is appropriate for them to the recovery that they need. And that's, again, the beauty of Reaction. There's so many pros. A con that people may find it, Akon is Akon. Sounds like an Akon, the rapper.
We're going to pause this so we can listen to some of his music.
I know, right? We should. Just intermission. It's really just the con that people continue to say or bring up is, that's a lot. I'm going to go try the insurance route. Well, go do it. I'm not going to stop you. I'm going to give you the tools and give you the information for you to make the best decision for you. Because in the end, everything is a business. Everything.
Sure.
And when you're going to a doctor, some have great bedside manner because they understand what it is to be in the medical field and they understand what it is to be a patient. They want to provide you with optimal care, but because they can, whatever setting they're in. But then you have some doctors that are pumping patients in and out. They have 5 minute increments with patients because that's how the insurance-based system is.
Yeah.
But on the other side of that is they're getting a constant cash flow. Even though they're having to see more patients, they don't have to worry about that next patient coming through the door. In my field and what I'm doing in terms of the cash-based, if I'm not developing the framework to get the referral source from other people, I can't keep my doors open. But when I do get them, my word of mouth is substantial. It's significant. I get people through the door. I get people ready to come in because they know they're going to get the care they need. So it's really and truly, what avenue do you want to go down? Do you want to go down the avenue where you're getting that one-on-one, where you're getting that communication, where you're getting to tell your story, where you're getting everything that you should be getting in that hour 15 minutes? And yeah, it's going to be an investment, but you know what you're going to get, as opposed to going into another traditional clinic where you have no idea who you're going to speak with. You have no idea if you're going to see that same person again. You're going to get something handed to you, but it's going to be generic. It's hard to provide a very customized program in a very small window.
Right.
It's just, you can't do it. It's not physically possible with the setup that most doctors have, most PT clinics have, because they don't have the time. They just don't. We have the time. We have the resources. There's just so many more things that you can get out of it. And it's an easy decision. But again, I completely respect the investment in this world and what the insurance has really made it out to be. In terms of, if you go anywhere outside the network, you're going to have to pay out of pocket.
Yeah.
And sure, but if you take the time to look at if insurance, right? So let's make it very, very simple. Insurance, they're charging $100, right? They have to submit this $100 to the insurance. Insurance is like, no, we're not going to pay $100. Let's bump it down to $50. They're like, well,
these are fictitious numbers.
Sure.
But when they drop it like that, is it just something they're pulling out of the air?
I'm going to be honest, they are trying to base it off of a big pool of what other clinics say. I'm back in this insurance space. I'm charging $100. We submit it to the insurance. They're going to go based on maybe 10, 15, 20 other clinics. They're only charging $60, $50. Well, shoot, I'm going to only pay you less than that because they're submitting that much. So we're going to drop lower. So it is based on other like clinics, and there's other factors that go into it. But yes, ultimately, we're going to send you way less than what you're trying to submit for.
It's a constant game of how little can I pay?
Oh yeah, exactly. So because insurance is doing that, you're looking at the PT clinic having to, if we're trying to get $100 and they're only giving you half.
Now I've got to pay the other $50.
No, not you as the patient.
Yeah.
No. Your insurance, you're paying $100 a month, period, okay. Right? And you're paying a copay of $25. And then in the insurance world, you submit what is called a super bill. And this is, if try and stay with me, but you only pay a fixed amount. Some insurances only make you pay a fixed amount. And you're only allotted 8 visits. When you start getting outside of those visits is when you're going to start paying out of pocket. Does that make sense? Yeah. And so going back to that other portion of us as PTs submit $100 charge, insurance is like, no, we're going to send you $50. but you either take it or leave it. Well, who else is going to pay then? You have to take the 50, and then you have 3 other patients to see to make up for the $100 that you originally charged.
That's where the 4 patients come in at a time.
Yes, and they have to do that in order to stay at that level. Does that make sense?
Yeah.
And then ours,
yeah, but no.
Right? Like, it's still a business. They still have to figure out a way to make money. And ours is very black and white. And if we want to keep our doors open, this is what we're charging. You know? So it's just it's. I get it from an insurance standpoint, but it sucks.
You know, it's funny because everything's expensive now. Everything is, and it's interesting because I'm one of those people that go, "Oh, that sounds like a lot of money."
Yeah, no, yeah.
You know, but it's funny because Tim Ingram is my wife's nephew, or our nephew, and so I've talked to him before, and it's so interesting because when you hear somebody like him or somebody like you talk about the investment in your health. It's, you know, and he'll with him, we've had a conversation like, how much do you spend on going to the movies or going
Sure.
out?
Yeah.
You know?
That's like, always an easy way to look at it.
You can come to the gym 6 times on that. And you know, a lot of times when you go, okay, where are my priorities, right? And when you start to prioritize your health, that's no longer... You can find room in your budget for that.
Sure.
You know, and it's just a matter of changing your mind and your thought process to go in, what are my needs? What's best for me? You know, you were talking earlier about, you know, the 4 people coming in at a time. And it's interesting because with something with like what you do, it's to me, I think it's so cool because if somebody comes and goes, I saw you had a ballerina in the other day, you know, and it's kind of like, what is your goal? Mm-hmm. You know, if we go to a regular physical therapist and they put us on a program, doing these movements,
right?
You know, you can cut out, now there's all movements going to be interconnected, right?
Right.
But at the same time, you can gear that and tailor that to, hey, you do these movements constantly. Mm-hmm. This is what we're going to focus on. And like you said, it's more of a tailored type thing. And there's a lot of benefit in being able to do that. You know, instead of just doing something that's typical out of the box.
Yeah.
You know, hey, everybody does this program, and then you can go back to doing whatever you're doing. You know, being able to have somebody to go, okay, let's break down what your needs are. Mm-hmm. You know, these are your needs, and that's where a specialist comes in, right?
Right, 100%.
And that's worth X amount of dollars,
right? You
know, so
yeah, and I mean, you know, the price point is always something is a very big conversation, and I thankfully, you know,
who does that? Who does the pricing when you talk to
me?
You do?
Yeah, I do. I do it. And you know, as much as I'd like to say,
you need to hire somebody who's real mean.
All right, this is it,
and you can go, I did not want to charge you that.
I know. Put it on someone else. See, the thing is like, I think I've gotten really, really comfortable with it, with the whole money talk, just because. If this is something that's not meant for you, I'll be honest. Like, hey, go utilize your insurance. I know you've put money through, you know, and you invested money into it. Go do it. And, you know, if you have any questions, you can always come back and ask. No problem. And a lot of the times that puts people at ease, because one thing that I've learned in general is you're always trying to sell something. Mm-hmm. Always. Even in some which way, shape, or form, you're selling something. And whether it is, in fact, building value in coming into a cash-based clinic, or you're talking to a buddy and you're like, and you want them to come over to watch a football game, you're selling the idea of coming to hang out with you. And it's it's easier because it's not that sticking point of money. And once you kind of realize that everything is a little bit like that, it just becomes easier to where when you bring up the price point, if it is in fact something they're not interested in, no problem. We do have, you know, we do offer a version of payment, or we do offer payment plans, because I do understand it's an investment. But in the end, there's so much value in it. If you don't see the value, then we're not the right place for you. Sure. And we make it very, very simple in that light, because I don't want to make it a battle between insurance. If you feel that you're going to get the same care going to that clinic, I'm confident enough to know that we'll see you back here.
Yeah.
And not naysaying on PTs that are in those clinics. It's just, I was in that setting. I know what is there. And I think we had a great setup. I think that Text PTS is awesome. I think that I refer patients to them if they want to go that route, but in the end, their limitations are their limitations, and that's just kind of what it is. And we know what we can offer. We have all these tools, and we've seen it successful over and over and over again.
So what are you offering? Now, I saw your website, and I saw some cool stuff.
Yeah.
But tell everybody exactly, I guess, your wheelhouse.
Sure.
What are the things you offering? What are kind of some of the injuries that you kind of are pretty typical seeing come in? And why are maybe you seeing that so often?
Yeah, no, that's a good question at the end.
Oh, I'm amazing at this.
Okay, well, our population that we see, I just looked at myself and I'm just kidding.
Make sure you're centered.
I know, right? I've been moving.
Okay.
Anyways, so bringing it back to the point, the first part of your question, I think, was what do we offer? Right. And we offer a gamut of treatment, and it's not just treatments. It's not because we didn't specialize in one area or the other. It's because we've been doing it for so long. So
you're adding tools to the toolbox. So,
exactly. Yeah. And thankfully myself and the team that we've developed at Reaction, we are specialists, or we've gone through the residency program and specialize in certain areas. And so the treatment methods that we offer begin with personalized programming. And that could be for a high performance athlete, or that can be very foundational, right? Depending on where the athlete is at. And I love that we get you to the starting line, or, the traditional PTs get you to the starting line. We get you past that. That's fantastic. So we offer I know, right? I'm going to use it from now on. Make sure you got that.
It's yours. We'll cut it out of this.
I know, right? Make it sound so good. And then also, the tools that we utilize, actual tools, are instrument assisted soft tissue massage. So it's very commonly known as like Graston technique. It's a metal tool that basically allows us to save our hands but promote blood flow. So instrument assisted soft tissue massage, just basic soft tissue massage.
Bless you.
It's not a cough.
Oh,
but thank you.
That's why I took these, because this is coughing season. So pollen was super high in San
Oh, I didn't know that. Yeah, I'll take one for fun. Thank you. So soft tissue massage, and then we also use trigger point dry needling, which is a big tool for maintenance, which can be, a lot of people always ask, like, is that acupuncture?
That's what I was wondering. Because
it's similar. It's similar. We use the same tools. But what we also add on to that is not trigger point dry needling. It's stimulation, electrical stimulation. You could do needling with or without it. I still have that tickle. And with the trigger point dry needling, there's two different methods of doing it. You can allow the needle to sit in the muscle belly.
So how deep are you going?
All the way down to the bone, depending on
what.
Yeah.
No.
I promise.
No. The needle is going to the bone.
Let's just talk about like your glute. Well, hold on. Let me finish what we offer.
How much that was off camera, but hell no, not now.
It depends on where you're at.
Do you know how thick I am? I don't even know if you have needles that long.
We have needles. We do have some pretty long needles. Just saying. Okay. It may be that we could not. So we have a backdrop, and most of the time, let's just talk about hamstrings. Hamstrings an easy.
I got lightheaded. I'm sorry.
Sorry. You can get to the bone as a backdrop. There's, if you're talking about the lung space, right, where your upper back is at, you want to use a rib as a backdrop. Or if you're confident enough to know the anatomy, you can still needle what are called the intercostals of the ribs, right? You can feel the bony part of the ribs, and there's muscles in between the ribs. Mm-hmm. You can needle in between that, but you need to know your depth. You have a depth check, right? Or else you're going to go into the lung space. You don't want to do that.
And so these needles are going in, and something's connecting to the needle, right?
Nothing is connected to the needle. There's no medication.
No, but like there's like an electric.
You can do the electrical stimulation. It could be with or without.
I did see I saw the.
Yeah.
Okay.
You can do that. That's an option, and that's going to be really based on that's an athlete based. It really determines on where they're at.
Yeah.
Right. So we do offer that. We offer cupping. We offer compression therapy.
What does cupping do? Because I see a lot of people do that. It looks like a bunch of hickeys.
It really does.
I have no clue what it's doing though. Is it just really moving blood around?
Ultimately, yes. Okay. It's the suctioning. It's suctioning from the cup, and it's bringing blood flow to that area.
Okay.
So that constant suction is allowing, once you release it, it kind of brings all that blood flow back to the area. It's almost dehydrating that muscle belly.
So let me ask you this while you cough.
Yeah, it just like, what the heck?
I'm just picking on you. Let me ask you this. So I get that blood flow sounds like it's an amazing thing.
Sure.
What exactly is happening when you're removing blood from an area and pushing blood back in? What's the benefit of that? I mean, it's got to be good, right? Because
Sure.
blood flow is always great. But what is exactly happening to the muscle tissue when you do that?
You think about when you cut yourself. What happens? Blood surfaces to the skin.
I faint. So
Okay.
I don't know what happens after that.
Okay, well, don't. Yeah, do you understand the
I'm joking.
scenario?
Yes,
though?
yes.
Okay, good. The blood being sent to that area is the healing proteins to allow the muscle belly to repair. Does that make sense? So with the suctioning, you're actually sucking on the skin, and what's happening is you're sucking more blood flow to that specific cup.
So so I'm an idiot, right? So I just
not.
now caught on to what you're saying.
Okay, good.
So it's not it's the blood, yes, but it's the good stuff that's in the blood that it's drawing to the muscle.
Exactly.
Gotcha. Okay.
There's proteins in the blood that need to get to the area that's been said compromised. Like, let's say you're working out and you get sore because the muscle belly does break down, right? And so when you get soreness, when you do put a cup on that area, it's bringing more blood to that area and ultimately helping with the healing process. It's not speeding it up by any means, but what it's allowing the area that's compromised when you're after a workout, the muscle breaks down, you put the cup, more blood gets there. It's facilitating that healing process from this position to this position. And then you have what is called protein synthesis, rebuilding that muscle, and then you get stronger, better, faster, all that stuff.
All right. I'm going to ask you something.
Do it.
So I've kind of been thinking about how long this has been going on. Mm-hmm. And it's been years. I get that my weight contributes a lot to back problems.
Sure, it can.
But I have this weird thing now where it's almost like my spine's here, right? Mm-hmm. And then there's the right lonja. And right about here, there's this sharp pain.
Okay.
Now, at first I was like, maybe it's sciatic. And sometimes when I get up to pee in the middle of the night, when I step with my left leg,
okay,
it hurts terribly. But I noticed this is kind of the strange thing is when I'm asleep, it takes me a while. It's almost like my back's no longer in tension or compression. And so I'm relaxing and I start to spasm.
Okay.
And so finally it kind of goes away. I get comfortable. I sleep weird too. Like I'll sleep kind of twisted and contorted at times. But when I get up in the mornings, and this has been consistent for like probably about 8 months now.
Okay.
It's been off and on for years, but here, like 8 months has been like consistent. Where I'll get up to get out of bed, and this is the other stupid part. I'm in the guest bedroom.
Okay.
I'm on a harder bed because our purple beds are for fat people. I'll tell you right now.
For real?
Oh, they're not.
You have a purple bed?
Don't get the purple
Don't
number
get the purple
3
bed. Okay.
if you're fat. It ain't gonna work out. So I destroyed that bed. So I'm sleeping on an old mattress that's firmer. And
Okay.
at first it was kind of like, okay, this is cool. You know, I had a little shoulder issues too. And slowly it just stopped. Morning, it's on the floor because it was my bachelor bed. So it's still on the floor. And so when I get up off the floor, like it's super tight. I get up and some days it hurts more.
Sure.
But I'll go sit down. And once I get up to pee, if it's 4 or 5 in the morning, I'm not going back to bed.
Really?
So I'll go sit in a chair.
Okay.
And in about 20, 30 minutes, I can get up and I'm fine.
You're fine.
For the rest of the day. Like if I do something or I can feel like a little tweak,
Yeah.
nothing like first thing in the morning.
Really?
So and I'll be honest with you. I started, this is one thing that I'm super inconsistent, right? And so I started to get to the point where I'm like, okay, I took a kettlebell and I took a resistance band
Okay.
to work. So every hour, every 30 minutes, I get up, walk around the office a little bit. I do some resistance bands.
Nice.
I used to do some kettlebell swings, but recently I kind of stopped because it was just putting a lot of tension on my lower back.
Okay.
So now I'll just kind of hold it. I think it's like 35 pounds or something. So I'll hold it just to kind of engage, core muscles and whatever.
Sure.
And then I'll do that like every 30 minutes, every hour.
Not bad.
And then I've gotten to the point where I saw something weird on the internet. It was like, hey, stretch out your rib cage and see how good you feel. I'm a big fat guy who sits at a desk all day. So I'm constantly in this hunched over position, right? And so I guess about a week and a half, when I get up to do my exercises, I'll raise my hands as high as I can, and I'll hold them there for 10 seconds. And
nice.
Then I'll just kind of, and it's almost like I'm reaching as far as I can.
Yeah, exactly.
To kind of stretch, my sternum and my rib cage out, and I'll do that every hour of every 30 minutes as well. And so I've noticed slowly that stretching has been helping.
Okay.
But holy crap, some days, and if I don't take aspirin or the weed cream, oh girl,
The back hurts, that same area?
It's that, and it's
like pinpoint, I bet.
It's majority in one spot.
Okay.
Every now and then I'll get like a spasm across the whole back, but usually it's that one spot.
I see.
And then I was like, well, maybe I'll talk to Danielle and come do the needle thing. But now it's going to go all the way to my pelvis.
Well, I mean, that's my backdrop. You won't tell the difference whether it's in your knee, whether it's in your bone or not. It won't go in your bone. But that's the backdrop. Here's the thing. You have, it sounds muscular in nature. And when it's very pinpoint.
It sounds pretty awesome. Just to hear you talking to me and saying muscular. I'm a dude right away.
Well, there you go. You're like, hey, I got muscle there. I mean, it is. You have muscle there.
So how do you know if it's muscle or nerve?
So nerve, I don't.
Okay.
Right? But you didn't mention anything about any type of shooting or radiating pain down your
No,
leg.
it's like I said, every now and then when I walk and I step, I feel it. But it's not like, it's like I've read on sciatica, and it's like a lightning thing that moves.
Exactly.
And I don't really have it down the leg.
If it's very much localized, what happens with your pelvis, right? You gave a good example. If you have this spine column here and then your pelvis sits on the outside, just like picture Mickey ears. And you're looking at your backside, so this is the pelvis, and this is where you have your pain. You have a lot of muscles that insert right in here. That if your pelvis is slightly shifted, it can be what is considered an upslip or slightly tilted, either what is called posteriorly or anteriorly. You're getting a lot of tension in that one specific area.
Could that be the way I'm sitting?
It definitely could be. So like, let's say you're kind of sitting like this.
Well, no, I sit postured up.
And then leaning forward.
On my thighs, and I'm leaning forward, but a hair to the left.
If you think about all that pressure, even if it is for 30 minutes.
Why you gotta say all that pressure?
I'm just saying pressure in general. You know what I'm saying? You could benefit from the needling. I do think it could provide you some relief. I like to think of it as an accessory to the foundational program that we can build for you. Can it help?
How deep are you going into me?
I mean, the needle can be pretty long. Like if we use,
let's say if it's this spot, what are we hitting? Because we got to hit bone. You said
we don't necessarily. You have a backdrop, and the backdrop can be if you think about those Mickey ears, it can be the very crest of your hip bone, or your pelvis. So we could, in fact, just depending exactly where I'm, what is called palpating or touching. That is what I have to think about the structures that live back there. So it can in fact be the crest, or it may just be your muscle tissue, and I'm only going to go so far. And a lot of the times I don't need to go very far before I'm hitting organs, but I don't go that deep. So it can be bone most of the time. And you think about superficially, like just think about your hand, you can hit bone instantly.
Oh. Fixing to pass out.
Don't pass out. Stay with me here. So, I mean, it doesn't necessarily have to be bone, but the needle itself, the intent is you have a muscle belly that presents that way. And I'm thinking that if you can still visualize with me, those Mickey Mouse ears, this is your spine, and this is the spot of pain that you continue to feel. I can stick the needle directly in that muscle belly that essentially presents like this. And then the needle going inside that muscle belly may or may not elicit an involuntary muscle contraction. And it'll do this number. And it feels weird. And then it'll recruit blood flow to that area and essentially go from this to this and reduce that tightness or that constant ache or pain that you're feeling in that area. Does that make sense? Mm-hmm. Now, a question that I usually get is, where does this contraction come from?
Right.
Well, how do your muscles work to begin with? You have to tell it to contract. Yeah. It goes from mind to muscle. And there's an electrical current that runs through your body, very, very small. But it's very, this is the electrical current. It's going to give you like waves, right? You can see the waves through there. Mm-hmm. And that's a stretched out muscle belly, normal. When you have a tight muscle belly, it's very compact like this. Yeah. So when the needle goes in there, it's basically disrupting that quick current. And then it's going to basically open it up again. So when you're putting that needle into that muscle belly, it's going to cause it to squeeze and then open up.
That's why you've got to go so deep.
Yes. So that way I can get that electrical current that is essentially has very long wavelengths in your bicep. It just looks like this. And when it's tight, you're making those wavelengths get tighter, and you put the needle in there, it's going to make it contract because it's disrupting and then open it up again. So that's where that involuntary contraction comes from, because our body naturally has these small wavelengths that are living in our body. And when you have that muscle that's in a more condensed position or tighter, and we can use back to that example where your back is, it's tight, you put the needle in there, there's where it's going to disrupt that electrical current, squeeze, open up, you get blood flow there. So, the needle can help in a lot of ways. You can use the electrical current to your advantage. You put the needle in there, you put another, like basically a base where the needle is in that problematic area. And then you have another needle that you can basically connect like jumper cables. And then you can put the electrical stimulation to it to kind of massage that area.
So the first scenario, the muscle is going to contract and release only by penetrating it with a needle? Like there's no electrical stimulation in that? It's just the needle going in?
Just the needle, yeah. Because your body has, again, that small electrical current running through your body that you need it in order for your muscle to contract.
Gotcha.
Does that make sense?
Yeah.
And so if you do get a tight muscle belly, you put the needle into that tight muscle belly. It doesn't have to contract involuntarily, but it could, where you just like feel like a jump out of nowhere because the needle was, into the muscle. That's where you get that involuntary contraction.
Okay.
So there's a lot of good to it.
Super interesting.
Yeah, and if you're, it's something that I recommend everyone give it a try at least once, because there's a lot of promise to it. I'm a big advocate of it. That's why I dove into it. There's like levels that you can get certified in, right? You have your advanced needling, then advanced level 2, advanced level 3. So we can needle just about anything except for maybe the eye. Right? You're not going to needle the eye directly unless you're an ophthalmologist or something.
Oh, wow.
That's not me.
No.
Otherwise, you can needle the pelvic floor. Muscles. A lot of these areas that I needle can help reduce headaches. You have the upper trap that can reduce headaches. You can needle shoulder. You have tight muscles in your shoulder. Just about anywhere I've needled.
Let me ask you this. And this is just me thinking while you're talking. I got a buddy who has a strange kind of nerve condition.
Okay, strange. You just started with strange.
It's interesting because I don't understand it thoroughly. But it's my understanding that the muscles in his face start to get really tight and contract. Okay. And for a long time, it was to the point where he couldn't even open his eyes.
Oh wow.
So now I think I don't know if he takes medication, but I know he's doing Botox. Okay. And so they give him the Botox to get those muscles in his face at attention. Something like this, would that help as well?
In
Or
theory,
maybe not so much?
because I'm trying to think of what diagnosis he may have, but when you have muscles that are tightened in that area, Botox, and I'm not sure what exactly is happening below the surface as to why Botox helps, but when even your eye muscles, you have eye muscles, you could essentially needle in the orbital space. Excuse me, but it's not something that I do often. It's really when you're getting close to this area, it's truthfully I would refer out at that point. So I understand that Botox can be beneficial in that specific space.
So going back to, I guess, injuries that you see a lot that are pretty common. What's coming through your office? What's coming through your gym?
The most common that I think I get, man, if I'm being honest, it can really vary depending on which athlete population I'm working with. It's not uncommon to see knee injuries or knee problems. That's something that I'm really, really exposed to often. Another common body part that I see are shoulders. I do get a lot of patients that present with shoulder issues or athletes that are trying to elevate their performance. Or, are they in a position where they're trying to elevate their performance? So we'll get a lot of knees and shoulders. And then we've been blessed in our setting to really work on elevating their performance. And I mean that in the most utmost high level performance training that I can possibly talk to or speak to. Because right now we're working with a lot of boxers at the professional level, amateur level. Same thing with baseball. We have very high level performing pitchers that are moving on to the collegiate level. And then there's a lot of tie-in to athletes that are trying to elevate their performance, from football to baseball to gymnastics to cheer to ballet. They all have some tie-in in terms of how we're going to program for them. For example, ballerinas, I love the phrase elegant. They have to be elegantly explosive. It's just
that
mind blowing.
Sounds pretty badass,
right? Like the things they do is mind blowing.
Yeah.
Same thing with cheer; they have to be explosive, but in a very deliberate manner. Same thing with gymnastics, and then you have baseball; they have to be explosive, but in a different plane. Same thing with boxing; they only have 2 minutes of explosive work. So explosive is still in the same range of someone as elegant as ballet or still involving the same approach.
How exciting is that for you to have such a diverse clientele to where, because, I would imagine when you really enjoy what you do and you love what you do, it's awesome, right?
Mm-hmm.
But when you get to a point where your mind is actually stimulated, you're not pumping out these exercises that are repetitive for the same people. It's like, this is a whole new problem, and you get to try and figure it out. How exciting is that?
Just hearing you ask, I get excited.
I'm pumped up, and I don't know what the hell I'm talking about.
What's funny is I didn't know what the heck I was doing when I first delved into the ballerina space. I was blessed to have an amazing mentor who was a retired professional ballet dancer.
Oh, wow.
And I mean, I just was a sponge learning so many things. And so it's still exciting to, when a ballerina comes through the door, they're like, hey, this specific position really gives me problems. It's not going to be go do a leg lift. I'll tell you that much. Yeah. I have to really dive into the muscle belly, and in that position, let's just use first position, right? In first position, they're having an issue with their knee, but it's only when they're going into arabesque and, dissecting those movements. Okay, how am I going to reproduce that movement and be able to help them train and get stronger? And then I have my baseball player who has a shoulder issue, but it's only when it's in the deceleration phase. I need to figure out how to strengthen the posterior aspect of their shoulder, but how am I going to build a program specific to that? So and I'm seeing all variety of athletes, right? I'm not lying. It is so exciting. And to fix that problem for them and see them through, because I mean, that's where the phrase came from, building better athletes.
Yeah.
We want to make sure that we're giving them the exact movement that they need to not just get better, but to last.
Right.
So many people, so many PTs miss the boat. We're just trying to get you back there. That's not what we're trying to do. We're not just trying to get you there. We're just not trying to get you better than where you were before. We want to see you make it in the sport as long as you want to be in it.
Yeah.
We're blessed to work with professionals. And we take pride in that. We want to make sure that, because at the professional level, it's no longer getting to the professional level. It's a matter. It's like their livelihood.
Sure, it's how they provide for their family.
Exactly. Yeah. And granted, they're providing very well.
Yeah.
But if they can't perform, and they can't, if they can't perform, that's a problem, right? We need them to be able to do that. So we want to get them
at that level,
there.
there's a small window where they're capable of performing.
Exactly.
So it's kind of similar to what you were saying with some of the movements and exercise earlier. You've got this small window to where you have to optimize all your movement. And it's for maybe 3 or 4 years, and
that's all they get, or their contract is only putting them at 2-3 years. If they're not performing better than what they said they were going to do, and they don't, let's say for the first year, they're elevating, they're hitting their markers. Here comes year 2, they've plateaued because they had a small setback of an injury. And now they're not, they can't perform where they were because they weren't built to last.
Yeah.
Right? I don't even know what slogan that is, but whoever said it, good for them, right? We're building them to last.
Yeah.
And I get so pumped because I'm seeing it happen. I'm seeing these athletes really capitalize and perform at a level they didn't think they could. And it wasn't because we had some magic tool. It was because we took the time to dissect that movement and be able to build a program around that movement and around what they want to do and see them through it, and then build outside of that. Now we know how we can get them to excel because we took the time, we built the program, we have the tools, and now they're performing at a level they didn't think they could. And it's so exciting to see. And then going back to the other level of excitement, a schedule for me would look like ballet, baseball, football, boxing, ballet, boxing, basketball. I don't see the same. Let's not forget gymnastics. Let's not forget my competitive cheerleaders, where this is just off the top of my head. I niche down in the performing arts realm, but going back to what I spoke about earlier, from ballet to boxing, they both have explosiveness involved. I just have the time and the ability to be able to break it down in their respective sport, right? I know in my performing arts athletes, I know what to look for, but because I dove into it for 7 years. In the boxing world, I have taken the time these last 2 years to really expose myself. And in between, I've had the baseball, I've had the football, I've had the basketball training throughout my residency. So learning the need analysis for each sport and how to really tailor to each one is something that we pride ourselves in, right? But again, niching down and really diving into the performing arts realm is where we've capitalized. But it's not to say we can't provide programming for these athletes and get them to the next level. Because if you have if you're working with a true sports performance therapist, they should have the tools to get them to the next level. That's which is awesome. Super exciting.
It sounds amazing. I think that to see your passion in it, I absolutely love it. I think that when you talk about it with the passion that you do, and you break it down the way you do, for somebody who's on the fence with whether or not this is an investment they want to make,
sure,
to me, it's a no-brainer. Now granted, I'm not a high performer,
sure,
but at the same time, there's as you get older, I was talking about this back issue, right? Mm-hmm. I'm not joking when I said it's been 8 months.
Yeah, and
of consistency.
Sucks.
And it's funny because you start walking weird, you start stepping weird,
yeah.
And then all of a sudden everything starts breaking down. Mm-hmm. And when you were in your 20s and your early 30s, it was like, I'll be good in a couple of days.
I'll walk it off, I'll be fine.
Now you get to the point where it's like, man, if I don't do something about this, it's going to progress, and it's going to get worse, and it's going to affect other things. And
100%.
before you know it, you find yourself not being able to do things that you used to, and now you start getting into now your quality of life is starting to be affected.
Exactly, and that's where we still are able to, we don't push that, but we definitely are able to see you from a rehab standpoint. I consider myself a weekend warrior. I am no longer at the high level that I wish I was at back in the college days, right? Like we're not there. But the same time, that is still a capability where we're able to provide those foundational treatments that are going to help get you to the starting line, get you to where your movement patterns are not causing an issue. Because if you back 8 months ago when you started moving funny and your body says, I'm all right. Yeah. Just keep moving forward, right? Because you're not thinking twice about it. It's not really putting you down and out. 8 months later of still moving with that weird pattern, something's got to give. And your back, unfortunately, is one of them. Yeah. So, there's definitely something we can do for you. And is needling something that you may want to exhaust? I highly recommend it.
I may have to Google it. I may go do it just so I can say I made you needle a fat guy.
Oh my God. Just so you know, there's a lot of big guys out there from, football players. We have the privilege of working with some big college football players. And they may or may not be flirting with the same size that you're at. We can do it. It's just something that I was very concerned because he was a big feller. Not just, width wise, but height wise. I was like, I don't even think it's going to fit at all. He was just a big man. Yeah. And so my point is the fit in terms of we have larger tables at the collegiate level that are very conducive to be able to withstand such a gentleman. I wasn't sure if we could. It worked out just fine, but needling was still something that was very helpful for him. Yeah. And so read up on it if you want. There's a lot of good that comes from it. There's very little that can come out of it. You might be sore, but I think you can handle that.
It was so weird because I was in a swimming pool, I guess, earlier this summer, and I had to stay in the shallow.
Okay.
Because when I went to the deep, it would just spasm all the way across.
Just because you were using your legs a lot more?
Well, no, I was just floating. There was no compression, of me standing.
Oh, I see what you're saying. So
when I was floating completely, it was like there was this
decompressed state.
Yeah. But it kept causing this massive spasm. We'll have to talk about it some more.
I think it'd be worth having a conversation. If you really it sounds like you're really that sucks.
It sucks really bad.
It does.
I'm not gonna lie.
I'm not gonna sugarcoat it.
I even told my wife. I said if I end up getting a call for a cold this summer, I said I gotta sleep sitting on the sofa because if I'm laying down and it's in that much tension and I cough and my core compresses, I was like, I don't know what's gonna happen. You're gonna hear me screaming across the house.
That's not something you don't want to live in that fear. You
know. What's funny that you say that is I've kind of gotten better here the last few weeks.
Oh, good.
But it got to the point. Well, I say mentally, I think I got better the last few weeks because it got to the point where I would start to get anxiety about going to bed.
Oh man,
because I was I don't want to go to sleep.
Yeah, because
shit's gonna hurt. So.
Then I definitely, if you have the insurance route, go for it. At the very minimum, what you're already doing in terms of moving constantly, that's ideal. That's one of the first things I tell anybody. If you are stagnant and you're not moving, everyone these days are stagnant. What has COVID done to us? Basically put us in a chair and put us in front of a computer.
Yeah.
You know what I'm saying? So back is something that has come up a lot more. Not near as much in my setting, but it's something that I really started getting exposed to in my more traditional setting, because that was what happened. We moved to a very, very seated position and for a prolonged period of time. And what we try and do is get you moving, right? One big rule of thumb that I always recommend is every 20 minutes stand up. 3 times in the hour you're standing. Do that. That's going to help you tremendously and at least get you out of that pelvic shift that you may be sitting in. Because if you're sitting and doing this number for 20 minutes at a time, your muscles are now contouring to that position and it's not favorable.
Well, it's weird because there'll be times where sitting at a desk, right? There'll be times where I might get deep into something and I haven't gotten up for 3 or 4 hours.
Yeah.
because I've been hyper focused on something that I was working on. And before I look at it, it's like, I've been here all morning and it's lunchtime. That was a long freaking time to be sitting there. And that's when I get super stiff. I'll increase it to 3 times in an hour. Like I said, for sure, it's been 1. Every now and then it's twice an hour. And I think I've noticed this past 2 or 3 days, I've been doing it twice an hour, every 30 minutes. And it's gotten better.
Good.
So I need to make sure it's every 20,
set
every 20 minutes.
Set a timer. Yeah. It's going to get annoying, but I will tell you that you're going to develop a habit, a pattern where your body a standing desk on purpose, because you don't want to stand for too long because your back doesn't like it. You don't want to sit for too long, and 20 minutes has kind of been the arbitrary number where that is more than enough time in any given position. I don't know how truck drivers do it. I don't know how software engineers do it. I don't know how people who have a seated job or a job that requires prolonged sitting. I don't know how you guys do it, because I personally cannot tolerate sitting that long. It's my body, maybe it's my mind, who knows? But my point being, if you can get in the habit of getting up 3 times out of the hour, you're already doing better than a lot of us that are in that unfortunate position. One company that really does a hell of a job making sure that you are standing is USAA. They invest in standing desks. Also, I'm working with a software engineer, and he built his own apparatus to where it stands and sits no matter, it'll raise even without him like doing anything, because he has this tool that will lift his desk up every 20 minutes, and he'll stay standing for 10 minutes and it'll lower again, and then 20 minutes come by, and that's kind of how it works. Yeah. And it's just it's a small change that makes a huge difference.
And you got to make a conscious decision to do that, because you
do, and it's not that big of a change.
No, it's not. It's not. It's very easy, and it. I mean, when you think about office jobs and desk jobs, it's like the entirety that those jobs have existed. It's been, here's your desk, here's your chair, sit down.
Exactly.
30-minute lunch, you leave at 5.
Yeah. You have the cubicles set up, and you pick a desk, go to work.
Yeah. And I mean, you really have to make a conscious effort to remind yourself to do those things, because like I said, there's times where I'm like, screw it, I'm just going to sit here all day. It's going to hurt anyway. And it's hurt way worse.
Yeah.
It's like, no, you got to get up. You got to move.
You have to. So. Yeah, you really do. Yeah. And making that small change will make a big difference, I think. But I do think that, if you have some time, we can definitely dive into that. We offer 30-minute consults. It's free. And honestly, what we do is dive into it a little bit more, really allow you to tell the story more in depth, and see if it's something that we can actually help with. And based on what you're telling me, I do think it is worth a conversation to at least get you something, right? The conversation and what a free 30-minute consult consists of is a true blue conversation. I'll have you move, do more functional movements. I won't put my hands on you, nothing like that.
Can I pay extra for that?
I mean, you could, yeah, but it won't get us very far. But what I'm saying is like in that same context, should you pay extra, then we're looking at the full depth evaluation.
Gotcha.
But the functional movement of it in that 30-minute consult can tell me a lot. Then it may get us through the door, and maybe asking more questions about what other treatment methods can we do. And to be honest, it really starts and stops with you, and not how much, but what investment, not financially, but movement wise, sure, you really want to put into it.
So with your hands, how big are the needles?
We can. The biggest needle we have is probably like this big, but their hair.
That's not terrible.
You see. And their hair follicle thick, right? Like grab one of they're tiny, 0.25. It's so small. So small.
Oh, okay, we'll have to talk about this.
See?
Danielle, where can people find you? What's your website and your social media and all that good stuff?
Yeah, you can find me anywhere. The handle that is really, really easy is Reaction, exactly as it sounds. _sport rehab. That is our handle for Facebook, for Instagram, and for TikTok. You can find us there. Those are the 3 platforms that we're most active on. Facebook, if I hadn't mentioned that. And our website is reactionsportsrehab.com. And, check us out there. You can send us a direct message. We're very active on social media. Like I said earlier, we're blessed to have a great team. We have a social media manager that saves lives and also saves our lives in the social media way.
And she's super quiet.
I know. You didn't even know she was here.
I forgot.
Right? I forget she's here all the time. I'm like scratching my back or maybe my butt. No, I'm kidding. And she doesn't even stop me, which is terrible. So yeah, that's how you can reach us. Please reach out, all of everyone who's listening. If you're tuning in, we do offer a discount, 50% off of our initial evaluation. It's a $295 value, so we do offer 50% off for anyone who reaches out and says they've heard us on the Gabe Molina podcast. Cool. We definitely, we want to support where we can. And if there's not even so much an issue, right? Like, we don't want you to wait till there's an issue. If you're starting your fitness journey and you want to make sure that you're moving correctly, we're your clinic to come to.
Yeah.
So yeah, please look us up. And thanks so much for having us.
Absolutely. Thanks for coming on.
Yeah.
I really enjoyed the first time we had a conversation at that event with Renee.
Oh man, so did we.
That was a lot of fun. So that was a good opportunity to see a lot of different athletes. But
yeah,
it's interesting because there's a lot of diversity in what people can get into and get excited about.
Yes.
And it all involves movement and muscle, right? I think there's a lot that you can learn and you can do on your own, but you start to plateau after a while where your knowledge base stops. And that's where you need somebody who specializes in this kind of thing. That's where you need somebody that can go, you know what, you've plateaued, but with a few tweaks, we can push you farther and you can thrive even better. So.
Exactly. And then maintenance is also something that we like to capitalize in the injury prevention realm. You hit it, the nail on the head. I always get that saying wrong, but I think I got it right.
I love when you pay me compliments. You need to come more often, girl.
Well, you're welcome.
Well, thank you so much.
I appreciate you, Gabe. Thank you.
Thank you. Thanks, everybody, for listening.
Thanks for listening to the Gabe Molina podcast.